Hey, what's up? Dr. Prasoon here. If you're suffering from high blood pressure, then you might have several questions in your mind. Doesn't these medicines have side effects? What is the right time to take these medicines? What is the right time to check your blood pressure? Should you be taking these medicines for a lifetime? What are some natural ways of controlling blood pressure without taking medicines? If you want to find the answers for these questions, please stay tuned because this is Dofudi, the best online doctor consultation platform in India. So let's get started. If you haven't subscribed to our channel yet, please do it right now. And when you do that, please click on the bell icon so that you do not miss out on our future videos. The most common question that I get from my patients is that should they be taking medicines for a lifetime when they have been started on these medicines to reduce and control their blood pressure? And the answer is it depends on your age, it depends on your lifestyle, it depends on your blood pressure control, it depends on other medical conditions that you're suffering from. If you're a young person, say about 30 years old, and if your lifestyle is good, if you are working out regularly, if your salt intake in your diet is low, if you are not overweight, then if you have been started on any medicines, the chances are that you will be able to stop these medicines within a short time. It actually depends on the level of blood pressure control that is required for an individual. On the other hand, if you are an older person, your blood vessel walls, your arterial walls will be thick and stiff, and it will be very difficult to control blood pressure in such persons without taking medicines. So what I recommend my patients is that if your lifestyle is healthy one, if you are cutting down on the salt intake in your diet, if your body weight is in the normal range, if you are doing physical exercises regularly, then there is a high chance that you will be able to stop these medicines. And I actually encourage them to do that. I have done several videos on high blood pressure, and you will be able to find the links to those videos in the description box below. The second question, which is the best time to take the medicines for high blood pressure? Should it be taken in the morning or should it be taken at the night time? And the answer is that it actually doesn't matter. Many studies have shown that most of these medicines which are used to treat high blood pressure have an action of 24 hours or more, and it can be actually taken in morning or at night time, and it doesn't really matter. But there is a catch. There are some medicines that should be better taken in the morning, and there are certain other medicines which should not be taken at night time. For example, some medicines belonging to the group diuretics, which are also called as water pills, should not be taken in the night time. Now what these water pills or diuretics does is that they remove excess of fluid from your body, and if you take such medicines at the night time before you go to bed, you might experience an increased frequency of urination, and therefore your sleep might be disturbed. And if you are suffering from high blood pressure, it is better that your sleep is a good one and it is not disturbed. There are certain other medicines such as calcium channel blockers, which works by relaxing the smooth muscles in the blood vessels. Now, if such medicines are taken at night time, they might relax the smooth muscles in your esophagus, your stomach, and if you are a person who is already suffering from acid reflux disease, it will be better to take such medicines in the morning time because these symptoms, the acid reflux, tends to increase when you lie down. Another important question which my patients ask is that what is the best time to check their blood pressure? And the answer is that your blood pressure should be checked in the morning. Human physiology is tuned in such a way that a normal person's blood pressure tends to decrease by 10 to 15% at night time when you're sleeping, and after 4 a.m. in the morning, it tends to increase. And it reaches a peak between 6 a.m. and 12 in the noon. So that is the time when your blood pressure should be checked ideally. And there is one more thing. You should check your blood pressure before you take your morning medicine dose. I know some patients who believe that checking blood pressure after taking medicines is the right thing to do. It is actually not. If you check your blood pressure 2 to 3 hours after taking the morning medicine dose, then your blood pressure recording will be a false one. It will be in the normal range, but it will give you a false sense of security. Ideally, you should check your blood pressure at least 3 or 4 times in a week if you are suffering from resistant hypertension or if you are taking more than 2 medicines to control your blood pressure. Otherwise, you should check at least once in a month. 6 a.m. to 12 noon. That is coincidentally the most common time when strokes and myocardial infarctions or heart attacks tends to happen. And that will be the time your blood pressure will be highest during any time of the day. And so that is the best time to check your blood pressure. The next common question which I get from my patients is regarding the side effects of these medicines which are used to control blood pressure. The answer is that there are certain side effects for certain groups of medicines. And the fact that you should take home is that there are several types of medicines which are available right now to control blood pressure. Your doctor will decide the right type of medicines, the right combinations based on your age, your gender, your medical condition, and your blood pressure recordings. If you're a person who has been newly started on medicines to control blood pressure, you might experience tiredness and fatigability, and this often lasts for 2 or 3 weeks. This is because when you're taking medicines for high blood pressure, and when we are trying to bring your blood pressure back to a normal value from a higher value, your body will take some time to adapt. And it is during this adaptation time that you will experience the most tiredness and fatigability. So new patients who have been started on medicines need not worry. These tiredness and other side effects often tend to go away all by themselves within 2 or 3 weeks. Some other common side effects of diuretics is that they increase your frequency of micturition. Calcium channel blocker medicines such as amlodipine, nifedipine works by dilating the blood vessels, and therefore some patients, say about 30% of patients, might experience swelling in their lower extremities, in their ankle area, and it is not a problem, it is just a cosmetic one when those patients are put on calcium channel blockers. If you are experiencing side effects which is disturbing your normal daily routine and which is making you so uncomfortable that you find it very difficult to get out of your bed, that time you should definitely talk to your doctor, consult a doctor and get his expert opinion. Sometimes your medicine might need a change. Another question which I get from my patients is that what are the natural ways to control blood pressure without taking medicines? And the answer is that of course there are some natural ways of controlling your blood pressure, and often these steps will be resorted to before starting you on medicines. And some of these measures include adopting a healthy diet, decreasing the sodium or salt intake in your diet to less than 6 grams per day, avoid food items which are high in salt such as puppets, pickles, and other salted food items. Salt is highly used in ready to eat and other fast foods which are available, so please don't use such food items. Do some physical exercise regularly. It is recommended that you should do at least 30 minutes of aerobic exercise every day for 5 days a week. You should have at least 6 hours of sleep daily. If your sleep is disturbed, the chances of your blood pressure to get in control is very unlikely. Quit smoking and reduce the alcohol consumption. And if possible, practice meditation. Do it for at least 5 or 10 minutes every single day. It will keep you focused and it will keep the stress levels to a minimum. And it will also help you control your blood pressure and bring it to a normal value. All these steps will ensure that your blood pressure will come to a normal value, and these steps will help you keep the medicines away. Another question which I often get is that when will the doctor start me on medicines? And the answer is that if 2 high blood pressure values have been recorded for you on 2 separate occasions, your doctor will recommend you to change your lifestyle, adopt a healthy diet, switch over to a low salt diet, do some exercises, and even after adopting these measures, if your blood pressure is not controlled, only then your doctor will ask you to start medicine for controlling your blood pressure. Another question is that why is the doctor prescribing 2 medicines in the beginning itself to control my blood pressure? And the answer is that many studies have repeatedly shown that instead of taking a full dose of one medicine, it is better to start a combination therapy with two medicines which has different mechanisms to control your blood pressure, and these two medicines need not be at their full strength or full dose. When such a combination therapy is used, your blood pressure will be controlled very easily and without causing too much side effects. You might need to take two separate medicines only if a single preparation of two separate medicines is not available. This happens only in government hospitals, and if you are buying your own medicines, then these two medicines will come in a single tablet preparation, which will be easier to take every single day. So those were some of the common questions which I get from my patients who are suffering from high blood pressure. I hope you found the answers very helpful and useful one. If you really liked it, please consider sharing it with your friends and family. Please hit on the subscribe button. And if you have more questions regarding your blood pressure, you can ask doctors using the Dofody app, using chat, audio call or video call. So I'll see you in the next one. It is me, Dr. Prasoon, signing off. Take care, stay healthy, and thank you so much for watching.